Good evening, sir. First of all, I wanted to apologize because I couldn't report last meeting because a lot was happening in my life. But anyway, thank you so much, sir, because you still give me a chance to pass it. So, my topic is all about the attention deficit and attention deficit hyperactivity disorder or ADHD. So, what is ADHD? ADHD or attention deficit and attention deficit hyperactivity disorder, it is a development neuropsychiatric disorder that affects the executive system of the brain, which make it difficult for young learners and young adults to have focus in attention and to control of hand behavior. So, ADHD, it is one of the most common neurodevelopmental disorders of childhood. So, it is ADHD. It is usually first diagnosed in children. I mean childhood and often lasts into adulthood. So, children with children with having an ADHD, they experience to have trouble paying attention, controlling impulsive behavior, that may act without thinking about what the result will be, or children be it can causes it having an ADHD because of their overly active. So let's move on to the sign and symptoms of ADHD. So in children, it is normal to have a trouble focusing and behaving at one time to another. So, however, children with having an ADHD, they not just grow out of this kind of behavior. The symptoms will continue, can be severe, and can cause also difficulty in their school, their home, and also their friends. Now, there are three types of ADHD. So, first is predominantly inattentive presentation. The second one, predominantly hyperactive impulsive presentation. And the last one will be the combined presentation. So, let's enumerate it one by one. So, first, the predominantly inattentive presentation. It is a hard for a person, the individual of a person na kanang na maglisod sila pag-organize or to finish their task, also to pay attention to details or to follow instruction or a conversation. So this kind of person, it easily distracted or kanang to forget details in their daily routine. So the next one is the predominantly hyperactive presentation. So it is neurobehavioral disorders that characterized by hyperactivity and impulsivity. So it is when we say hyperactivity, it is moving constantly, including in situation where this is appropriate, fidgeting, excessive talking, restlessness, and to wearing others out. And the impulsibility, it is kanang to making hastily or kanang unplanned actions such as kanang interrupting others or making big decision without considering consequences. Kanang dili sila maguna-una kung unsay mga consequences na mahitabo, or desire for immediate rewards, or inability to delay gratification. So the last one will be the combined presentation. So combined presentation, it is characterized by both hyperactivity and explosivity. So combined presentation, if symptoms were enough of both criteria, inattention and hyperactivity and impulsivity were present for the past 6 months. So those are the three types of ADHD, or attention deficit and attention deficit hyperactivity disorder. So now let's move on to the causes of ADHD. So ADHD can cause by eating too much, watching too much television, or a social and environmental factors such as poverty or family chaos. Of course, many things including this might make symptoms worse. Mas pag once na dili nimo siya i-avoid, so mas mo worse pa siya kanang ang symptoms mo grabe pag yun. So especially in certain people, but the evidence is not strong enough to conclude that they are the main causes of ADHD. So we're now in school-based program. So in the 1960s, William Cruikshank established an education program for children that manifest the characteristic of a person with ADHD. So this program, or the program, has two categories. So first category is the environmental modification technique, wherein we remove irrelevant stimuli as much as possible. So the second one is the structured curriculum, which emphasizes that the teacher direction. So first is the environmental modification technique. So environmental modification, they are preventive and whole class approach that may decrease chronic behavioral problems for the students who are at risk, and allow children with a minimal or no problem behavior to access learning without interruption. So in environmental modification techniques, there are some aspects in learning environmental to fit the needs of a child. So first is to arrange the seats in rows or in a U shape facing the teacher, rather than in a round table. The second one, teacher must assign space for group activities. Third, have the child sit in front or to near the teacher desk para mabantayan ang bata ng teacher. So the next one, sit the child away from the door or window and other distractions. So this is important because once na kanang ang bata manggod kay pag bisag gamay ra na siya nga kuan, madisturbo na jud na siya. especially kanang once na dapat gayud na ang bata kailangan jud siya nga kanang ibutang or i-arrange or kanang pa-encodon jud siya sa area nga walay jud distraction sa iya kay para maka-focus siya pagpamati sa teacher. Kay bisag kuan ra na kanang for example sa iyang bintana, pag once na yaon siya sa kilid ng bintana, ang kilid niya kay kuan window, then makita din niya kung unsay mga binuhatan sa mga bata sa gawas. Like for example, kanang na nagdula, so which means ma-distract na sila. Di na sila maka-focus kung unsay gitudlo sa teacher. So importante jud na siya. So, fifth, create a quiet area free or distraction for test taking and quiet study. The next one, assign a specific cubicle or have the child face a blank wall if necessary. So, a teacher provide an individual self or storage space to help the child organize his things. The next one, explain and outline the rules, limit and expectation. Post them on the board. And 9, color code materials for each subject. The last one, be consistent. Teacher must be consistent with the routines inside the classroom. So, those are the aspects in learning environmental to fit the all needs of a children. So now let's move on to the structured curriculum. So structured curriculum, a teacher has to make a significant adjustments in the rules, procedure, and expectation to shelter the particular needs of their students with having a ADHD. So, the child having a ADHD will respond more positively to curriculum that allows him choices and options. He will also be more likely to participate actively in tasks when there is a degree of creativity and novelty. So, there are 4 tips for teacher on how to deal with pupils who are having an ADHD. So, first, before the lesson, teacher must divide the lesson into meaningful chunks. Teacher provide a roadmap for pupils to follow and also to introduce the day's objectives and explain the purpose and the expected outcome of the lesson. Next one will be the instruction and modeling. Yes, it is important to instruct and to be a model of to your pupils of having, especially those pupils having ADHD. So, instruction and modeling, teacher must keep the instruction samples to demonstrate the concept to the pupils, give plenty of examples, use vivid visual aids, teach note-taking, outlining, and other useful study skills, and incorporate the children's interest into lesson plan. So, the third one will be guided practice. So, teacher must allow the body system. Teacher give activities that allow the encourage movement such as competitive games And teacher must give activities that are stimulating and relevant to the child life experiences para mas masabtan jud nila. Break up tasks into workable and obtainable steps. Teacher must allow for occasional breaks to let the children relax and re-energize. And also, teacher must correct or reteach if necessary before giving an independent practice. So the last tips will be the independent practice. So teacher must give written and verbal instruction to their pupils. And teacher will remind the pupils to stay on task and reduce the number of time tests, give credit for partial work, give performance-based tests, listen to the number of assignments, and also it is important to give a specific due dates of their assignments because naman gud uban nga magsalig ba kay kuan kanang ay company usay kay ang teacher man god mo na sige okay lang pag malate gani na dili siya sa specific na due dates or kanang kuan mo na ay mo sugot ra man ni si ma'am kay so kailangan jud siya nga maghatag og specific due dates and you need kanang maging stricto ka talaga dito dahil para ma-practice ng students or pupils na dili magsalig. The last, next is explain all steps necessary to complete the assignments and post them on the board. And teacher must provide a model to help the students post the model and refer to it often. The last one, teacher must require the children keep on a file of their complete work. So those are the tips for teacher on how to deal with having an ADHD students. I think that's all to my report and thank you for listening.